What do we do when we evaluate the semen? First, we evaluate the semen itself. How much semen is in the ejaculate? What's the pH? How thick is it? What's the color? How long does it take to liquefy? That's all the general characteristics of the semen. Next, the semen are put on the microscope, and we look at the sperm themselves. The average male has over 50 million per cc in his ejaculate. We call it low when it's under 20 million per cc because that's when fertility seems to really be affected. Next, we look at motility, how fast the sperm are moving. Are they moving straight, in a straight line, heading for that egg? Or are they swimming slowly, in circles, not getting anywhere? Lastly, are they dead and not moving at all? We want at least 25% to be rapidly moving forward, aiming for the egg. Next, the sperm are stained on a slide, and we look at what they look like. Big heads, little heads, double tails. Those are all abnormal sperm. There are different ways to count the percentage of abnormal sperm. For years, the World Health Organization told us that 30% abnormal was our cutoff, and 70% normal was great. One researcher in an IVF lab, he decided to correlate his semen analysis with IVF outcome. He was very strict on what he was willing to call a normal sperm. So much so that anything less than 4% was his cutoff for very abnormal. He said that if your sperm was less than 4% normal, there was an increased odds that the sperm would not fertilize an egg, even in the in vitro fertilization lab. Since his publication, more and more laboratories and even the World Health Organization have tried to use his Strict Kruger Morphology as our reference. So now, 96% abnormal sperm forms is actually okay, but less than 4% sperm forms is worrisome for failed fertilization.